This is the Muscle Movers presentation of the American College of Sports Medicine's Certified Personal Trainer. Module 1, Unit 3, Video 1, Muscles of the Hip Region. There are a variety of muscles within the hip region that we're going to discuss. The first one is the gluteus maximus. This is one of three muscles that make up the gluteus complex. The action of the gluteus maximus is to help provide hip extension and external rotation of the femur. Exercises that target the gluteus maximus include the squat, lunge, or leg press. You can see the gluteus maximus highlighted in the picture on the right, and it is the most superficial of the three gluteus complex muscles that we'll discuss today. The next deep muscle within the gluteus complex is the gluteus medius. The gluteus medius helps perform hip abduction, or taking the femur away from the midline of the body. Some exercises that help target the gluteus medius include side leg raises, or hip abduction. You can see the gluteus medius highlighted in the picture to the right, and you can also see in the picture to the right that the individual is performing side leg raises with manual resistance on the lateral portion of the thigh. The last of the three gluteus complex muscles include the gluteus minimus. The gluteus minimus helps perform hip abduction, taking the femur away from the midline of the body, and internal rotation of the hip. Some exercises that help target the gluteus minimus include side leg raises of the femur while the femur is internally rotated. You can notice that the gluteus minimus is highlighted in the picture to the right, and that the individual has internally rotated their femur or internally rotated their thigh and is performing side leg raises against manual resistance applied to the lateral portion of the thigh. Another muscle within the hip region is the tensor fasciae lata. The tensor fasciae lata helps perform hip flexion and hip abduction. Some exercises that target the tensor fasciae lata include step-ups and front leg raises. Notice in the picture on the right that the individual is performing a front leg raise against manual resistance applied to the anterior portion of the thigh. Another muscle within the hip region is the iliacus. The iliacus helps perform hip flexion. Notice that the iliacus is highlighted and there's an arrow pointed to the iliacus. There are two muscles really close to one another within this region, and the iliacus is identified as the arrow points to it. Some exercises that could help target the iliacus include any sort of hip flexion pressing exercises. Notice the individual is laying on their back along a table, and they are pressing their femur upwards or pressing their thigh upwards in a hip flexion movement against manual resistance that's being applied to the distal femur. The psoas major is the second muscle within this region that lies right next to the iliacus. The psoas major helps with hip flexion as well and is targeted by any hip flexion pressing exercise. Here you see the hip flexion press against manual resistance applied to the distal end of the femur or thigh. This is Module 1, Unit 3, Video 2, Muscles of the Groin Region. The adductor brevis is one of the muscles of the groin region. Brevis means short. There'll be 3 adductor muscles that we discuss, and the brevis is the shortest one. You can see the adductor brevis in the picture on the right, as it's the muscle with the arrow pointed towards it. The action of the adductor brevis is to help provide support for hip adduction, or bringing the thigh in towards the midline of the body. Some exercises that can activate the adductor brevis includes adduction leg raises, where the individual lays on their side and adducts their leg, as well as squats and lunges. The adductor longus is the second of the 3rd adductor muscles that we'll discuss. Longus means long, and as you can see, the adductor longus is being pointed to with the arrow on the picture on the right as the longer adductor muscle. The adductor longus helps with hip abduction, bringing the leg in towards the midline of the body. And once again, some exercises that the adductor longus some exercises that can be performed to activate the adductor longus include an adduction leg raise, where the individual is laying on their side, or squatting or lunges. The adductor magnus is the 3rd and final adductor muscle that we'll discuss today. Magnus means large, and you can see on the picture on the right, the adductor magnus is being pointed to as the large muscle with the arrow pointed towards it. The adductor magnus also helps with hip adduction, or bringing the thigh in towards the midline of the body. And some exercises to activate the adductor magnus include adductor leg raise and the squat and lunge. The gracilis is another muscle that is within the groin region and helps with hip adduction, or bringing the thigh in towards the midline of the body. An adduction leg raise or squat and lunge are exercises that can help activate the gracilis. The sartorius is another muscle within the groin region. The sartorius helps with hip flexion, hip abduction, or bringing the thigh away from the midline of the body, external rotation of the femur, and knee flexion. Some exercises to activate the sartorius include a lateral and straight leg raise, hip flexion, leg curl or hamstring curl, and abduction press, where the individual abducts their femur and there's manual resistance applied to the lateral portion of the leg as they perform the hip abduction. This is Module 1, Unit 3, Video 3, Muscles of the Thigh and Leg Regions. The quadriceps is one of the major muscle groups within the anterior portion of the thigh. As the name would suggest, there are 4 separate muscles that make up the quadriceps muscle group. 2 of the muscles include the rectus femoris and the vastus intermedius. Both of these muscles lie down the center of the thigh, or the midline of the thigh, and the vastus intermedius is deep to the rectus femoris. The rectus femoris helps with hip flexion and knee extension, while the vastus intermedius only helps with knee extension. Some exercises that can be performed to activate the rectus femoris includes a leg press or leg extension, a squat, lunge, or step up, and a straight leg raise. Some exercises to activate the vastus intermedius include leg press, leg extension, squat, lunge, and step up. The 2 other muscles that make up the quadriceps muscle group include the vastus medialis, which is the muscle that lies on the medial portion of the anterior thigh, and the vastus lateralis, which is the muscle that lies on the lateral portion of the anterior thigh. Both the vastus medialis and the vastus lateralis help with knee extension. Some exercises that could be performed to help activate both the vastus medialis and vastus lateralis include leg press, leg extension, squat, lunge, and step up. On the posterior portion of the thigh, there is a muscle group, the hamstring muscle group, which is made up of 3 different muscles. The semitendinosus and semimembranosus are 2 of the 3 hamstring muscles within the hamstring group, and both of them help with hip extension and knee flexion. Some exercises that could activate the semitendinosus and semimembranosus include the squat or lunge, leg curl, and hip extension. The biceps femoris, as you can see in the bottom right picture, is one muscle with 2 different heads. Therefore, it's called bicep for the 2 heads. The action of the bicep femoris is hip extension and knee flexion, and some exercises that could be performed to target the bicep femoris include a squat, lunge, leg curl, and hip extension. The gastrocnemius is a muscle in the posterior portion of the lower leg. The gastrocnemius has both a lateral head and a medial head. The action of the gastrocnemius includes knee flexion as well as ankle plantar flexion, or pushing the toe away from the shin. Some exercises to help activate the gastrocnemius include heel raises, calf presses, leg curls, squats, lunges, and leg presses. The soleus is another muscle that is found on the posterior portion of the lower leg, and the soleus helps with plantar flexion when the knee is flexed. Some exercises to activate the soleus include seated calf presses, as the knee will be flexed when the individual client is in a seated position. The tibialis posterior is another posterior muscle along the lower leg, and it helps provide, when activated, the tibialis posterior helps provide movement for plantar flexion of the ankle as well as inversion of the foot. Some exercises that could be done to activate the tibialis posterior include plantar flexion and inversion using a 4-way ankle with either manual resistance, as you see in the picture below, or with a rubber band. The tibialis anterior helps perform the movements of dorsiflexion, or bringing the toes towards the shin, and inversion, or bringing the soles of the feet inward towards the midline of the body. Some exercises that could be performed to help activate the tibialis anterior include a 4-way ankle, where you perform dorsiflexion or inversion against manual resistance, as you see in the picture on the right, or resistance against a rubber band. This is Module 1, Unit 3, Video 4, Muscles of the Trunk Region. The rectus abdominis is one of the muscles on the anterior portion of the trunk. The rectus abdominis helps perform both trunk flexion and abdominal compression. Some exercises that can be performed to activate the rectus abdominis include crunches and planks. There are 2 oblique muscles on either side of the body, the internal obliques and the external obliques. The internal obliques are deeper compared to the external obliques, which are more superficial. When using both the internal obliques or performing an exercise in which you're performing bilateral contractions of both the left and right internal obliques, it helps perform trunk flexion. When contracting an internal oblique unilaterally, meaning only contracting either the left internal oblique or the right internal oblique, the internal obliques help perform lateral flexion of the trunk and trunk rotation. Some exercises that can be performed to activate the internal obliques include the crunch and side planks. The external obliques are more superficial compared to the internal obliques. Once again, when contracting both external obliques at the same time in a bilateral fashion, the external obliques help perform trunk flexion. When contracting the external obliques unilaterally, meaning only contracting either the right external oblique or the left external oblique, the external obliques will help with lateral flexion of the trunk and trunk rotation. Some exercises that can be performed to help activate the external obliques include the crunch and planks. The transverse abdominals is the deepest abdominal muscle, and its muscle fibers are in a horizontal fashion, and it helps with compression of the abdomen and helps support the stability of the lumbar spine when activated. Some exercises that can help activate the transverse abdominals includes forced exhale, crunch, and posterior pelvic tilt. The erector spinae is a large muscle group along the posterior portion of the trunk. When contracting bilaterally on either side of the spinal column, the erector spinae will help with trunk extension. When contracting unilaterally, either contracting the left side or the right side of the erector spinae muscle group, the erector spinae muscle group will help with trunk lateral flexion. Some exercises that can help activate the erector spinae include back extension, or commonly known as Supermans, to help activate this muscle group. The quadratus lumbarum is another muscle group found along the posterior portion of the lower part of the torso. The quadratus lumbarum helps perform lateral flexion of the trunk. Some exercises that can be performed to activate the quadratus lumbarum include rotary exercises. This is Module 1, Unit 3, Video 5, Muscles of the Shoulder Girdle Region. The deltoid is one of the major muscles along the shoulder girdle region and is divided into 3 different portions or fibers: the anterior deltoid, the lateral deltoid, and the posterior deltoid. The anterior deltoid helps perform shoulder abduction, or moving the arm away from the midline of the body, shoulder flexion, shoulder internal rotation, and horizontal adduction, or bringing the arm in towards the center of the midline within the transverse plane. The lateral deltoid helps perform shoulder abduction, or moving the arm away from the midline. The posterior deltoid helps perform shoulder abduction, or moving the arm away from the midline of the body, shoulder extension, external rotation of the humerus, and horizontal abduction, or moving the arm away from the body within the transverse plane. Some exercises that can be performed to activate the anterior deltoid include military press and front raises. Some exercises that could be performed to activate the lateral deltoid include military press and lateral raises. And some exercises that could be performed to activate the posterior deltoid include reverse flies and shoulder extension. The pectoralis major is a large muscle group across the anterior portion of the trunk and the upper trunk. When activated, it helps perform shoulder adduction, internal rotation, and horizontal adduction. Some exercises that can be performed to help activate the pectoralis major include bench press, push-ups, and deltoid flies. The latissimus dorsi is a large muscle group along the posterior portion of the trunk. The action in which the latissimus dorsi helps perform includes shoulder extension and shoulder adduction, or bringing the arm inward towards the midline of the body. Some exercises that can be performed to help activate the latissimus dorsi include a seated row, a lat pull down, pull-ups, and chin-ups. The teres major is another muscle group that is along the posterior portion of the trunk and when activated, helps perform shoulder extension, shoulder adduction, or bringing the arm in towards the midline of the body, and internal rotation of the humerus. Some exercises that can be performed to activate the teres major include similar exercises as the latissimus dorsi, which were the pull-up, the chin-up, the lat pull-down. The rhomboids are another muscle group that are in the superior posterior portion of the trunk. The rhomboids help with scapular retraction and scapular elevation. Some exercises that can be performed to help activate the rhomboids includes rows, lat pull downs, and shoulder shrugs. The trapezius is a large muscle group on the superior portion of the posterior portion of the trunk. The trapezius, like the deltoid, is split up into three sections, including the upper trapezius, the middle trapezius, and the lower trapezius. The upper trapezius helps perform scapular elevation. The middle trapezius helps perform scapular retraction, and the lower trapezius helps perform scapular depression. Some exercises that can activate both the upper, middle, and lower trapezius include shoulder shrugs and rows. The levator scapula is another muscle along the posterior portion of the cervical region of the neck. The levator scapula helps with scapular elevation. Some exercises that can be performed to activate the levator scapula include shoulder shrugs. The serratus anterior is a muscle that is along the lateral aspect of the trunk and helps with scapular protraction. Some exercises that can be performed to help activate the serratus anterior include the serratus punch. The serratus punch is a pushing exercise in which includes scapular protraction at the end of the range of motion. The serratus punch can be performed, as you see in the picture, as the client lays on their back and performs an upward punch towards the ceiling while manual resistance is applied at the arm. The serratus punch can also be performed at the end of a push-up as the individual goes to the top of the push-up with their elbows extended. They go ahead and perform scapular protraction, an extra movement at the top of the push-up to help activate the serratus anterior. The pectoralis minor is another muscle along the anterior portion of the trunk. The pectoralis minor, when activated, helps with scapular depression and scapular protraction. The pectoralis minor can be activated when performing exercises such as the bench press with a scapular punch. The rotator cuff is a group of 4 muscles that are deep stabilizers of the glenohumeral joints. It helps with eccentric deceleration of the arm, as in when someone is throwing, and helps with internal and external rotation of the humerus. One of the four muscles that make up the rotator cuff is the supraspinatus. The supraspinatus is found on the superior portion of the scapula. When activated, the supraspinatus will help with shoulder abduction, or moving the arm away from the midline of the body. Some exercises that can be performed to activate the supraspinatus include scaption exercises, where the individual lays down in a prone position, and also lateral raises. The teres minor is the second of the four muscles that make up the rotator cuff. When activated, the teres minor helps perform shoulder external rotation and horizontal abduction, or moving the arm away from the midline of the body within the transverse plane. Exercises that can be performed to help activate the teres minor include external rotation exercises that you see in the picture on the right. You can see that the individual is externally rotating the humerus with their elbow bent at a 90-degree angle while manual resistance is being applied at the forearm. The infraspinatus is another muscle that makes up the rotator cuff muscle group. The infraspinatus, when activated, helps perform shoulder external rotation and horizontal abduction. Some exercises that can be performed to activate the infraspinatus include external rotation exercises, as you see in the picture below. The subscapularis is the fourth and final muscle that makes up the rotator cuff muscle group. The subscapularis, when activated, helps with shoulder internal rotation, and some exercises that can be performed with the subscapularis includes internal rotation exercises. You can see from the picture to the right of the screen that the subscapularis is on the anterior portion of the scapula itself, and the exercise that's being performed is an internal rotation in which the client is internally rotating the humerus with their elbow bent at 90 degrees while manual resistance is being applied to the forearm. This is Module 1, Unit 3, Video 6, Muscles of the Arm. The bicep brachii is one of the larger muscle groups on the anterior portion of the upper arm. When activated, the bicep brachii will help with elbow flexion and forearm supination. Some exercises to help activate the bicep brachii include bicep curls and hammer curls with supination. The brachioradialis is another muscle group that is found crossing the elbow joint on the anterior portion of the arm. When activated, the brachioradialis will help with elbow flexion. Some exercises that will help activate the brachioradialis include the hammer curl. The brachialis is another muscle group that we see crosses the elbow joint from the humerus to the forearm. When activated and contracting, the brachialis will help with elbow flexion. Some exercises that can help activate the brachialis include the reverse curl, in which the client is in a pronated position. The tricep brachii is another large muscle group that we see along the posterior portion of the arm that crosses the elbow joint. There are three heads to the tricep brachii. When working together or contracting together, the tricep brachii can help perform elbow extension. Some exercises that can be performed to activate the tricep brachii include triceps kickback, skull crushers, and tricep pushdown. The wrist flexor group helps with wrist flexion and phalange flexion. The muscles that go across the forearm that aid with wrist flexion include the flexor carpi radialis, the flexor carpi ulnaris, and the palmaris longus. The muscle group that helps with phalange flexion include the flexor digitorum superficialis. Wrist extensors are found on the posterior portion of the forearm when the client is in anatomical position, as the wrist flexors were found on the anterior portion of the forearm when the client is in anatomical position. The wrist extensors muscle groups include the extensor carpi radialis longus and extensor carpi radialis brevis. These muscle groups, found on the posterior portion of the forearm, help with wrist extension. The phalange extension muscle group includes the extensor digitorum.